So I'm kind of the food and nutrition guy, and most of the work I do is around food environments. I understand this is, the idea behind this is a research division meeting, a research in progress seminar. So I want to talk about my primary project underway. But before I get there, I think I should spend a little bit of time explaining the rationale and why I do what I do, because it seems like most people are not so familiar with my area, and unfortunately that includes most funders. It is what it is.
Reviewers.
Yeah. So I'm gonna spend a fair bit of time actually going through past work that I've done, which will be interesting to those of you who are seeing this for the first time, and those of you who I haven't presented actually in a while, so this might be new to a bunch of you. As I go through, if I need to speed it up, I got about like 40 minutes or so. So I'll try to. I got a bunch of slides, so I'll get through them quickly. So I have no disclosures or financial relationships of interest.
That's too bad.
But I'm working on getting some.
Yeah.
So hopefully that'll improve in the next short while. So physician, who's the physician in the room?
Physician.
I just asked. Oh,
You can raise your hands a little higher.
All right. Well, so family docs like me spend a lot of our time counseling patients, not so much on diet historically. But increasingly so, and that often feels a little bit like this or like this, because when they leave our offices, they have to go out and navigate this, and those are pictures from the Bronx, the neighborhoods where my patients live, and they make the point that food environments can really challenge doctors' good advice to help patients eat healthfully, and patients' good advice to try to implement intentions to try to implement that advice.
It was some time telling me that I just connected to this meeting.
A conference as family docs go to. What if we treat illness and send them right back to the same conditions that made them sick in the first place? So another relevant quote, this is from the National Academy of Medicine, formerly Institute of Medicine. This is a crappy cell phone picture that I took, but if I blow it up, it says, most chronic diseases are conditions, most chronic diseases and conditions are normal responses by normal people to an abnormal environment. Right, so let's talk about environment. Some of you have seen this slide before. I'm guessing I use it quite a bit. Does anyone know what this picture of? Just shout it out.
Potatoes and onions.
All right, so this is a produce aisle of a supermarket in an urban, low-income minority neighborhood. It's actually a supermarket right down the street from where I did residency in Philadelphia, which is marked on the map here with a V. If you go up the road just a couple miles to just a couple of blocks from where I lived during residency, you get a supermarket that has a produce aisle. So pretty big difference. Makes the case that neighborhood matters, environment matters. So let's talk about environment. So this is a figure from Tom Frieden in American Journal of Public Health from 2010, and what it shows is different interventions on health and their respective effort that we have to put in and the amount of population impact we get back. So here's us as doctors in the room counseling patients, educating them one-on-one, providing advice, which is really inefficient. And frustrating because it takes a lot of our effort, a lot of patients' effort. It doesn't generally have a lot of impact. So we might do better to intervene more on kind of primary drivers of bad health and health disparities. And socioeconomic factors are hard to intervene on. So maybe we might get almost as much bang for the buck, changing the environmental context. And so certainly, me and Tommy Frieden are the only ones that have that idea. So this is a plot of food environment articles published versus time. You can see there's just exploding interest in this area. So in the last 10 years, just really kind of an exponential rise. So that's about the time that I got into this business, but I think that's probably more coincident and causal. But don't tell Peter that. But in any case, being part of this rapid proliferation, I've kind of seen firsthand the problems with the studies and the research and the limitations. And that's got me to ask, why is everyone in such a hurry to get answers? And so what I'd like to do just to demonstrate that. So this is an apparent controversy that came out a couple of years after I got into this business. So this was a piece by Gina Colada in the New York Times suggesting that food deserts didn't matter. Does anyone know what a food desert is? You guys have heard that term before? What's a food desert? Anyone? Just shout it out. Anyone? Allison?
What?
What's a food desert?
It's an
It's an area where there's not a lot of good food on sale.
Not a lot of good food, right? So generally people can define it as not a lot of healthy food, or more specifically, it's most often defined as just an absence of supermarkets, which is problematic for lots of reasons that I'll get into. But in any case, the point is, this piece came out in the New York Times. It highlighted some of the research, coming out in some peer-reviewed journals, and said, there really wasn't a relationship with what people were eating or people's weight, right? So not so much of this, right? And then that same month, in the peer-reviewed journal Obesity, you get this study that says the opposite, that food environments do matter, that food deserts are important, and that when there are lower grocery stores or supermarkets available, BMI is higher, right? So what do we do about that? Well, I thought I knew why that discrepancy existed, and so along with Dr. Chambers here, well, actually no, before Dr. Chambers got involved, so I sent a letter to the New York Times, and like all the letters I sent to the New York Times, that one was unceremoniously not accepted. So then I got Earl involved and said, we should team up and write something for obesity, and we did. And then, the blazing pace of academic publishing came out almost a year later, which turned out not to be a problem because these issues were still very much in play then. And in fact, I wound up extending that piece that I wrote with Earl to write a full kind of review of the literature and commentary, which came out 2 years later, and the problems were still apparent then, and they're still apparent today. And so this is kind of an outline of those problems, and this is the setup for my K work. So I'm going to go through these pretty quickly, one by one. So let's talk about how you measure a food environment. So trying to understand what foods patients or subjects have access to, right? So if you wanted to do that expeditiously or efficiently, how would you do that? How would you figure out what food sources are in the community? Internet, okay, good. So you could do an internet search. So and what would you look for on the internet? A couple of resources. Maybe we don't have to put this back on board.
Do the area, Google, what's that thing where you take a picture?
Google Maps, yeah, that's a great way to do it, right? So that's something that people have done, and that's kind of a virtual way of doing what is the gold standard of just going out in the street, which takes a lot of time. That takes a lot of time too. So what people came up with early in this field was just to look at pre-existing data, directories, yellow pages, data sets that were collected for other reasons, and just use those. So that's all fine, well, and good if those data sets are accurate and represent what's on the ground. The thing is, I wasn't so convinced that they did. And so what I did was go onto the streets and see what I found, or more accurately, what the students found while I sat in my ivory tower in the air conditioning. So all the students were out pounding the pavement to see if this thing held up. So let's say there's a street anywhere. It could be in the Bronx, could be in Manhattan, could be anywhere in the country or in the world. So you got a pizza place, a deli, Taco Bell, pharmacy, and that's what you see when you walk down the street. And if what the business list tells you or the directory, if it gives you the same information, well, that's great. That's 100% accurate. You don't have to leave the air conditioning. You can just do an internet search, pull up the file, and all is good. But if the business list tells you this, well, then that's more of an issue. So you can see CVS lines up with CVS, and the deli lines up with the deli. But then you've got, Jim's Bodega versus Joe's Bodega. So is Jim's the same as Joe's? Is a bodega? Hard to say. You give that a cautionary check. Then you've got over here Taco Bell and Burger King. Clearly, those are two different fast food franchises. To the extent that fast food might contribute equally to people's diets, maybe you want to consider those the same. Again, a cautionary check, not exactly the same franchise. But then you've got, the 7-Eleven versus the produce market. Those are clearly different. You've got these two open lots where there's a dollar store and a pizza place. And then you've got this open lot where there's a Starbucks, which is technically correct because Starbucks supports a vacuum and won't fill any. But it doesn't speak well for data sets. So you might put something that's like 100%.
Don't worry about the funding. You've got another.
Yeah, you have
to accommodate.
It's so easy. So you might think like 100% accurate to something that's like, let's say there's 8 lots here. So now you've like 2 to 4 correct, so somewhere between 25 and 50% accurate. So, and just like you would a clinical test, you take your candidate test, which in this case is the business list or the directory, and compare it to your gold standard, which in this case is the ground observation. and you can do performance characteristics, sensitivity and positive predictive value. Sensitivity, how often what is on the ground actually appears in the data set. Positive predictive value, how often what's in the data set actually appears on the ground. Okay, so I did that for a data set that was commonly used in literature, very commonly, most commonly, dozens and dozens of published studies, unquestioned by reviewers apparently. What do you think I found in terms of sensitivity and positive predictive value?
Low.
How low?
40% sensitivity.
Wow, that's pretty pessimistic. That's
It's
my
low.
job. So not quite that bad, but not good, right? And actually worse than is actually represented here, because this was by lenient criteria, saying Joe's Bodega was Jim's Bodega, Taco Bell was Burger King. If we actually were strict, we get something more like that. Yeah. So terrible, and actually worse for, so, we did it by store type and by neighborhood, and there's some even worse than that. But the point is, you'd be better off flipping a coin, right?
What's PPV?
Positive predictive value.
So what is that?
So it's, in this case, it's how often what appears in the directory actually appears on the ground, actually exists on the ground. Okay. So in other words, it's just basically looking at your error rate for concord, like how often, how truthful this is, how accurate it is. Not very accurate, right?
And do you consider position, or if the thing appears on the block, is that okay?
Well, so
there is a lot-
that's a good question, right? So I can get into the nuance there, but like, we tried to match an address for address, right? So is it there? Is it in the data set where it's supposed to be? Is it not? But we were generous and said, is it, just that it appears on the street. The point is, though, is that this poorly represents what's actually on the ground and is really an inadequate substitution for going out and looking, and could explain a lot of this kind of, yes, there are food deserts, no, there aren't, in and of itself. I mean, this is a big issue. That's a huge problem. Imagine a clinical test that looks like this. We have some clinical tests that look like this, and they're no longer recommended, right? I mean, that's bad. That's not good. All right, so anyway, so that's problem number one. So people are using inaccurate data sets instead of going on the ground. But then when we go on the ground, so then you can go out on the ground, then the question is, what do you measure? What do you look at? And that's another thing people have struggled with. So this is a little bit of a dated study from 2010, dated analysis from 2010 from some colleagues at NCI, but it basically shows the focus of food environment research, and most of the studies are focusing on food stores and restaurants, predominantly. Specifically, they're focusing on supermarkets and fast food outlets. Supermarkets, which are conceived of as healthy, even though most of the junk food that people buy comes from supermarkets, and fast foods, which are conceived of as unhealthy, even though fast food places often sell salads, water, milk, kind of fruit. So those are a problem too, and that can explain a lot of the variability. And notably, this was the focus of all of the studies from that New York Times obesity controversy, right? So they all just looked at supermarkets and fast food. They all called supermarkets healthy and fast foods unhealthy. And that's all well and good, but that's only part of what's actually out there. Like, what are the food sources people are exposed to or have access to? So for instance, no one's talking about this. That's crazy, right? Especially in New York. So like street vendors. So we went out and we looked at street vendors, and we found almost 400 of them in the Bronx, and turned out about a quarter of them were selling healthier items like fresh produce and water. About 3/4 were selling candy, chips, soda, ethnic fast food, hot dogs, cheesesteaks, that kind of stuff. And there were differences by neighborhood. So this is just green carts, but it shows, so this is the Bronx. These little dots are where the green carts are. And you can see they're not really evenly distributed. They're kind of collected on top of each other. This map shows how they cluster. And those clouds are kind of like clouds of exposure or reach, like how much how much people have access to them. And you can see there are these big white areas without access to green carts, where they're not, getting out into the community. And you consider those like green cart deserts, right? So I mean, there's a lot of nuance here and a lot of detail I could talk about, but the point is just they're not evenly distributed, and they differ by neighborhood, and so do street vendors in general. So this is looking at street vendors across the Bronx, not just green carts, but healthful street vendors, which are white here, less helpful ones, which are black, and then kind of mixed street vendors, which are this gray color. And you can see in the summer, they're pretty much evenly distributed across the borough. But in the winter, they collapse down into the southwest quadrant with a disproportionate array of less helpful vendors at that time. And so I often say, for the clinicians in the room, or for the physicians anyway, the Bronx kind of looks like an anatomical heart. I often refer to it as the heart of darkness because it's where all the bad stuff happens, right? It's like the worst health outcomes in the state, worst, lowest level of healthy behaviors, and all that, kind of just disproportionately affected by stuff that we'd like to help improve. And if this is the heart of darkness, then this is the left ventricle, right? This is where all the action is. These are the most disadvantaged and challenged communities, and those are the most that are highly affected by least helpful vending in the winter months. That's what it looks like spatially. This is what it looks like statistically. A very busy slide. I don't want to go through it in detail, but I just want to point out kind of correlations between less healthy vending and diet-related health and demographic on top.
Sean, are those street vendors licensed, and can you get like a directory?
Oh, great question. Yeah. So 1/3 of all the street vendors we identified were licensed. 2/3.
They're
legally
all
licensed.
supposed to be, right?
Yes.
Yes.
They're all supposed to be, and the majority are not.
And do they get rated like the ABC?
Yes, they do. And even the permitted ones do. So green cards in
Like
particular.
a health thing, like how health, it's like a hygienic thing, right?
Well, for some reasons it's food safety. For some reasons it's just police harassment on people who are trying to make a living. And some reasons it's, that's a complicated thing. I actually addressed that in one of the papers. But the point is most of them are,
Rating,
most of them are
ABC.
unlicensed, unpermitted, and
The rest
informal.
Yeah.
So you'll recognize, the pictures that I had didn't show like people selling mangoes out of the side of a van,
Right.
people selling watermelons out of their trunk, people just pushing a street, like a literal shopping cart with homemade pastries and stuff, and that was all counted in our assessment. But that's the vast majority is not sanctioned informal selling. That said, so the main point here is that the more or less healthy vendors there are per capita in a neighborhood, the lower people's fruit and vegetable consumption, the higher their sugary sweetened beverage intake, higher their BMI, the more diabetes, the more dyslipidemia, the more hypertension, greater minority status, Hispanic, blah, blah, blah. So not so good. And differences by weather and season, I won't go into that now, but that's another important consideration that gets lost in a lot of these studies is they don't account for temporality or seasonal shifts, which are important. And these are some of the papers. In one of them, I addressed that very issue about the legality and the police harassment and the vendor issues. In any case, so the point is, it's not just supermarkets, it's not just restaurants. Street vendors are out there, and they probably matter. Yeah.
To what extent, I'm sure you've looked at this, is it kind of like reverse causality or, certain communities wanting certain?
Oh yeah, sure. That's a
can
huge issue.
you look at that?
So I can't cross-sectionally, but that's a goal moving forward. Yeah, that's a great point. Obviously, right? Yeah. So is it that vendors are going out and people are vendors are citing themselves in a certain place, and then people are having these bad health outcomes, or are people with these bad health outcomes just desirous of these products that are not good for them? Yeah, there's definitely a bi-directional association, and I can't tease that apart with this. But if we want to arrange things, with presumptive independent and presumptive dependent variables, then it's just anyway. So street vendors. So what else is out there? Well, what about this? So farmers markets, also not addressed, also not counted, also not talked about in the literature. This is from the Bronx. Go with the green full year. This is the botanical garden. All the other ones are, in the concrete jungle. But what we noted was that, and here's where they are located throughout the Bronx. Not as many as street vendors, but it's still a substantial number. Interestingly, what we noted in the Bronx is that a full third of what farmers markets sell is highly processed, refined, less healthful products. So things like jams, chilies, pastries, pies, scones. Give you a sense of, and that's on average. I should say at some farmers markets that was more than 50% of their products, and that was among their best-selling products and the things that they most highly promoted. That differed by neighborhood. This was just an example to give you got tub after tub of sugary beverage. You got pies, brownies, scones, croissants, cookies, a bunch of cream-filled concoctions that look like they came from a factory as opposed to a farm, or if they came from a plant, like a industrial processing kind as opposed to a living botanical kind. Interesting. And the point is that product line differed by neighborhood, right? So again, these are contextualized issues and important to consider. And part of what people are eating in the community. There's another paper I published on that with other detail, which I won't go into now. But the point is, farmers market probably also. And then the big thing that people miss, right? So street vendors, that might vary depending on community, and farmers markets also vary a good deal community to community. But I think something that's kind of ubiquitous and a reality for just about everyone, just about everywhere, is this. The pharmacies, and dollar stores, and sporting goods stores, quickie lubes, and laundromats, and every other conceivable kind of retail environment you can imagine that you don't think of as selling food, but that almost invariably have highly processed, prepackaged, sugary beverages, salty snacks, frozen confections, and the like, whether that's in the checkout line or back in the aisles or whatever. So this is huge. So other businesses, right? So not food stores, not restaurants, but just this concoction of other stuff that's selling food. These are actual pictures from the Bronx. So we actually looked at other businesses in the Bronx relative to Queens. You guys know this geography, right? You guys are familiar with Manhattan, Staten Island, Brooklyn, Queens. So again, the heart of darkness versus the Upper East Side of Manhattan, which is kind of the opposite. So very wealthy white community. And we looked at kind of what the environments were in the Bronx versus the Upper East Side. And this is kind of a typical picture of a Bronx street, a typical picture in the Upper East Side. And you see big differences in the number and kind of businesses offering food and drink. The number of other businesses, right? So not food stores or restaurants in the Bronx, there's like 1 in 5 were offering some kind of food or drink. Whereas in Manhattan, it's less than 1 in 10, closer to like 1 in 13. And then also the percent of healthful items and less healthful only items differed by neighborhood. So the bottom line is in the Bronx, there's many more businesses offering foods or beverages, and many more of them offering only less helpful options without healthy alternatives. To just give you an example of what it looks like, so a locksmith, gates, for all the world on the outside doesn't look like you get food or beverage there, but inside there's, soda and candy and chips and salty snacks. There's a laundromat, public place to wash the clothes. You might expect fabric softener and detergent. You probably wouldn't expect a big old scale sandwich counter.
They got it in.
They didn't get an A.
They what?
They got an A from the health department. And this was, the most surprising, I thought, and concerning and shocking. This is an actual doctor's office with Snapple, sugary beverage right away. So, other businesses, and so these are, one is under review, one is nearing submission. Sorry to Earl about this. Having a little trouble with these. But I'm diligently plugging along and submitting and submitting. So hopefully these will be out in the literature soon. But the point is other businesses also matter. And then you got other stuff too. So like, you got food pantries, right? So no one talks about emergency food. We looked at food pantries one summer and predominantly highly packaged, pre-processed, shelf-stable stuff that you see there, less on the healthy food, differences by neighborhood. And then not so much about food provision, but about food promotion. So advertising probably also matters to what people are eating. And so we looked at food advertising in the Bronx subway system. It showed that ads for less healthful foods were disproportionately found in neighborhoods where there were higher proportions of minorities, foreign-born residents, children, and they tended to be directed at kids, minorities, and in languages other than English. So in total, this is an opening line. Looking for funding and trying to get people to recognize this bit more. So there's this international food prize. People in Europe seem to be more attuned to this kind of thing. And so I put in an application, and this is the opening line from that submission that I recently put in. So foods and beverages are nearly ubiquitous today with placement and promotion of cheap, highly palatable, ultra-processed, unhealthful, convenience and impulse items just about everywhere, even in unexpected places and particularly directed at vulnerable groups. So that's kind of a bottom line of what everything I've been working on to this point has found. But it just highlights the point that there's a lot out there beyond food stores and restaurants, but we really need to be considering that. All right, so those are the first two, and then finally, quickly, the last one is about mapping for spatial considerations, or GIS, which stands for Geographic Information Systems. So those prior studies were problematic in that they used pre-existing effects, and they were problematic in that they only focused on food stores, and they were problematic in that they called supermarkets healthy. They were also problematic in how they assessed people's exposure, so what foods you had access to. So to get a sense of that, let's take a, so this is the northern part of Manhattan, right? This is the Bronx over here, New Jersey. And let's say we wanted to look at someone's food exposures in Harlem. So we'll take a little person drop right there. Okay. So how do we define what foods they're exposed to? So commonly, a way to do that is to pick some arbitrary distance and say everything within that distance, within that buffer, is part of that person's food environment. And so the most common way to do that is just to draw a circle. You know, pick a mile. Everything within that mile is part of that person's food environment. In that mile for this person is this marker right here, which happens to be a very nice Trader Joe's across the river. And so in order for that person to get to that Trader Joe's to do the shopping, they either have to canoe across the river and then canoe back with full bags of groceries, or they have to drive 6+ miles up the Henry Hudson Parkway, go over the GW Bridge, and down River Road, some of the worst traffic in the country, taking 30 minutes under the most optimistic scenario, and then drive that same distance back, and then pay $15 in tolls for the privilege. Right, so preposterous, right? At a glance, you can tell this is just ludicrous. And yet, this is what people do. This is how they do it. So, and just to make the point that how you measure exposure can lead to not only different conclusions, but opposite conclusions. So this is a scenario that some of you have seen before, but it's the same neighborhood, just presented in 3 different ways. So in this neighborhood, these gray lines are the streets. This orange marker here is someone's home or someone's school or someone's reference point, whatever you want to take. We could say, someone just lives there. The double lines here are train rails. The blue line here is a river. The apples are meant to be sources of healthy food, like say a produce cart or a greengrocer. The hamburgers are meant to be some source of less healthful food, it's a fast food outlet. And then we got these diamonds and triangles. The diamonds are unhealthful street vendors. The guys selling hot dogs and cotton candy and all that stuff. And the triangles are unhealthy other food stores, like the pharmacy and the gas station and the dollar store. Okay? When they're open, they're not counted. When they're closed, they're counted. All right, does that make sense for orientation? All right, so now the way people assess how this person's access is in one of 3 general ways. The first way is arbitrary administrative area. So that's like a zip code or census tract, and they just draw that administrative boundary around that person, and they look at all the food sources within. So for this census tract for this person, there's 2 hamburgers, 2 sources of healthy food, and all this other uncounted stuff. So it's 2 healthy versus 2 unhealthy, right? Even though these 2 sources of food are across train tracks that you probably wouldn't be crossing, and there's no roads that go there, those get counted. All right. The other way is to do what we just did on the previous slide with the Trader Joe's and Harlem example, right? So we take a person, we draw a circle around them. Now in this case, there's this edge here, this line, and we're going to say that's like a boundary between communities. So let's say the person funding your study really only cares about what's happening in your community, not what happens over the boundary. So you're only going to count what's happening in this part of the circle. And then what we get here is 3 apples and no other sources of food. So we got 3 healthy and 0 unhealthy, even though all of these are across the river across the river and across the train tracks where no roads go. And then, and I should say, this is how the environment was counted in all of the studies in the New York Times and the obesity article that I made. that Earl and I made comments on first, and then I commented on later. All right, and then here is another distance metric, but this is like a rational way of walking along existing streets or existing roadways, you know, some distance from a person's home, respecting, you know, natural boundaries to transit, like train tracks, and divided highways and rivers, and just going where you can go. And then also not neglecting the street vendors and the farmers markets and the other sources of food out there. And so you can see 1, 2, 3, 4, 5, 6, 7, 8 sources of unhealthy food. So you go from a neutral environment to a healthful environment to an unhealthful environment, all the same environment. That's just how you measure it. And so this fact alone can explain a lot of the discrepancy of yes, there's a food desert, no there, right? So a lot of problems in the literature. And that leads me to say we need some better science. So after 4 submissions in 3 years to 2 institutes by 1 investigator, me, the NIH finally submitted. Succumb. I was saying it Earl before. I'm going to submit until you submit. coming in until you get out. So I finally got funded. That happened in May of 2015, but they still begrudgingly took 3 months away from it, so it retroactively cycles to February, so I'm a little over halfway done at this point. And this is what I talked about in the case. So the problems to address are the 3 we just talked about, plus the 4th of the healthy supermarkets versus unhealthy fast food. And then the 5th we didn't talk about is looking at food sources in isolation. So like only considering fast food without also considering supermarkets, so not looking at interactions, modifiers. All right, so the solutions were to do what I'm proposing to do. So not use pre-existing directories or data sets, but actually go out and walk the street, or have students. Have students go out and walk the street. Not to consider just supermarkets or restaurants, but consider a full range of food sources. You know, the street vendors, the dollar stores, the fast food, the salons and the dollar stores, etc. To not have like crazy, arbitrary, nonsensical geometric shapes as people's exposures, but to look at like where they can walk and where they can, have access to along natural transit routes. To categorize food sources by what they actually sell. So not by whether they're a supermarket or a fast food outlet, or there are healthful foods there, or they're not healthful foods there, or what's the relationship. And then to look at the effect of food sources relative to each other. So not in isolation, but looking at, green carts in the context of the, fast food that's around them. All right, so these are my 3 specific aims. So the first was to conduct a comprehensive assessment of all the food sources, right? So not to rely on existing data sets, but to go out, see what's on the ground, and do a comprehensive assessment. So to directly observe and capture that. Then the second aim was to take that observational data from aim 1 and integrate it into a multi-level database that included other neighborhood, school, and individual characteristics, right? And the third aim is to assess how food source exposures, foods in the neighborhood, contribute to people's dietary intake or diet-related health outcomes, considering or factoring in all that other stuff in the middle, right? So this is done, and this is nearing completion. And so this is aim 1, all right? So initially, I won't go into all that. So what we're doing now, what I've resulted, what I wound up doing was picking 10 schools in the Bronx, which have school-based health clinics. And so Montefiore runs the largest school-based health program in the country. And so it's nice in that they are both schools, but also clinics. So you have data on not just students, but on patients. So picking those 10 schools in, kind of demographically distinct neighborhoods across the borough. We looked at a half-mile walking buffer. So, that's why these are all different shapes, because they're not arbitrary circles. They're going out along existing streets for a half mile and seeing what food sources are there, what's around the school. All right, and so the students walked a bunch of streets, so over 1,500, to assess for foods or drinks anywhere. So on either side of the street, yeah.
One distinction that the studies that you were mentioning before are primarily adults. And
Primarily, yeah.
okay, so, and then this is
adolescents.
Okay, the adolescents that have.
They're not all adults, but yeah, there's a mix. But I would say predominantly, that's probably true.
And is there some consideration of how children access their food environment as different than parents?
Sure, yeah. I mean,
how they
so
do that?
so increasingly as you age, you become more independent in your food choices. And so one of the variables in the model is obviously age or grade, stage of development. And I think it's going to be important. So I think, as kids go through the years, they do more of this on their own. By the time they're 13, though, most kids, I did some studies, and there's others who have done studies in Philadelphia and New York showing that they spend a preposterous amount of food away from home, often on their commute to and from school. So, it doesn't account for everything that they're eating, but in terms of policy implications, you don't have to fix everything. You have to fix something you can tweak and make a change on.
And when you think about walkability, though, how far they're willing or able to walk, does that matter? I mean, it's
sure, yeah. So we're going to model that too, right? Yeah. So we went out a half mile, but we'll look at half mile, we'll look at quarter mile, we might look at eighth of a mile and see if that matters, right? Does distance matter? How willing are people to go, and for what? But yeah, that all matters. And a half mile is arbitrary too. It's just a mile. It's just not possible. This took 2 summers of lots of lots of sweat. And,
This is amazing.
No.
Yes.
You're doing a feedback sandwich.
This is really wonderful, and so just because I'm just so interested, don't know anything about it, but I was just curious, wouldn't it? So kids aren't gonna walk half a mile,
No,
but
Well,
they might.
but-
No, they might. But so my question was I'm just curious the methodology. So for example, if you've got a school, doesn't it kind of matter where the 2 bus stops and the 2 train stations are, and
Yes.
wouldn't that be the more important?
Well, so we're also going to have data on kids' homes, so the kids that live within here. So we're going to presume that they live within a half mile. Maybe that's not an accurate presumption, but the path between their home and their home, right? So what is the path leaving?
So that's another analysis you're going to do.
Yeah. So we have some data on their homes too. So looking at the sources around their homes and along the path between home and school.
And also between the subway station and the school, or
Well,
or
so
heavily
we'll
used
have
bus
to figure
stops?
that out.
Because that's where they get off the subway and they.
Yeah, so there's a bunch of tricky stuff about that. And the other issues, are they open campuses? Can they leave during the day? Can they go out and grab something to eat and then come back? So those are all things that need to be considered. But yeah, important points. So they look for food or drink anywhere. So that means anywhere, right? So they didn't just walk by the lock shop. They had to go in it to see if there was food there. They don't sit out there to sell locks, because you go in there and you're surprised. And then we categorize, food businesses. So those are things you expect to sell food: green carts, delis, restaurants, cafes, etc. And then other businesses is everything else out there. And so we had a very detailed protocol for counting foods. So we had helpful categories for vegetables, nuts, what was a fruit and vegetable, what wasn't, what was a whole grain, what wasn't, etc. So students were trained in this, and then had these forms to go with them. And then we have these 2 unhelpful categories of food. Likewise for drinks, healthful water and milk, less healthful sugary drinks and alcohol, and then these 2 kind of middle categories within the literature. So we'll model them in different ways and see what we get. So juices and diet drinks. All right, so this is what we found. Now I could have a giant table on here with 10 columns for each of the schools, and what I did was just highlight the highest and lowest in each category, just to give you a sense of the range. Okay, so all businesses within a half mile, huge variation. So around school number 10, 71 businesses. Around school number 4, more than 5 times as many. And again, this is the map. So remember, this is the left ventricle, the heart of darkness, right? This is kind of the comparatively better side. So School number 10 on the comparatively better side, school number 4 up here. Offering food or drink, again, big differences in the proportion. So not looking at the absolute number, but proportionally. So anywhere from, just under a third to over half. That means in neighborhood number 5, you could walk into any business and have better than a 1 in 2 shot of finding food or beverage. Any business, anywhere. Walk through any door and better than a coin to execute. And then offering healthful food. So among those that, were in the food game, among the businesses that were out there, how many of them were offering healthful options? Again, big differences by neighborhood. And I should say we were generous in what we counted as helpful. So helpful included things like sugary, granola as whole grain, coated nuts for nuts, popcorn for whole grain, lettuce and tomato topping on, sandwiches, vegetable toppings on pizzas, right? So we were pretty generous. You should consider that when you're looking at the numbers. And then offering less healthful food. So now this is only what's helpful, meaning if you go in, that's the only option available to you. Like there's no helpful option there. So in school number 9, on the good side of the Bronx, less than 2% of schools. But in school number 3, on the left ventricle, more than 5 times as many, almost 10% of the businesses offering food only offers, junk food. Stuff like this. All right, that's looking at all comers. So that's looking at all the businesses in all the neighborhoods. So now what we did is subtract out the food business, subtract out the and just look at other businesses. Right, so the stuff you wouldn't expect to be selling food, but it does. And so other businesses account for, just over half to just over 3/4 of all the businesses out there. So reciprocally looking at that means that in neighborhoods, just under a quarter or just under a half are food businesses. That makes sense. Offering food and drink. So, as little as 9%, but as much as 10%. As much as a third are offering food or drink. Examples of places offering food or drink are these: auto shops, clothing stores, apartment stores, hair salons, tobacco shops, toy stores. This is what it looks like on the street. So this is a hair salon. The little girl over here. Sugary beverages over here. I think there was another case of something else I don't remember over here. This is a laundromat. People come and do their clothes, sitting or whatever. They got, candy, chips, soda, all kinds of stuff to snack on. And then this was a really interesting one. This is like income tax, real estate, notary public, all kinds of financial services. And there's like a full-on sweet shop inside. Like a counter, you can get cookies and donuts, pastry, and coffee, right on the inside. But not all of that was unhelpful. So a fair proportion offered some healthful items, up to 23% in some cases. And what did that look like? Oh, and healthful options were things like this: some fresh fruit, dried fruit, applesauce, salsa, granola, popcorn, whole grain crackers, nut seeds, trail mixes. So here's some examples of what that looked like. So again, another hair salon. This one selling nuts, though. These are just unsweetened peanuts. They're just plain peanuts. This is a dollar store. I have actually a really pretty impressive display of like whole grains, nuts, and seeds. That's a discount store. I think that's a Marshalls actually. There's no Marshalls. So you got dried whole fruit, dried nuts, and this is a pawn shop selling everything you can imagine, including fresh fried plantains right up front. Right now, like who would think that? What reviewer was going to read the papers cited in the New York Times? What about pawn shops? Nobody would do that. So that's aim number 1. Hopefully
Sean,
something publishable.
Gonna need to finish in no more than about 10 minutes, so.
Oh yeah.
Yeah, okay.
Totally.
All right. Totally got it under control. How did I not know that?
No, I thought you were saying 2 minutes. I could have done that too. All right. All right. So aim number 2 is to take all that food source data. Now we have to make this integrated data set. We're going to look at school data, which comes from the New York Department of Education and school websites, neighborhood data from the U.S. Census, and also the New York City Police Department, patient data from our EMR.
Your phone's ringing, Ben.
And so, we're collecting some of that data, putting it all together. We've done some, kind of basic preliminary correlations, and so far, here's what we found. So with school characteristics, so less helpful, there's less food or drink near schools with higher attendance rates that are more Asian and white students. There's more businesses offering only less helpful items around schools having more minority students. And there are fewer nuts, whole grains, or diet drinks around schools with more students in poverty. Now, those are for schools characteristics, which you would imagine might be reflective of larger neighborhood characteristics if most of the students are coming from the neighborhoods. If you look at correlations with the neighborhoods, so more businesses offer only less helpful items in neighborhoods with more Hispanic residents. Unhealthful food provision was correlated with the percent of residents who were foreign born. And greater percent of businesses offered only less helpful drinks when there were higher percent of minorities in the neighborhood. So conclusions from that is that food sources extend well beyond what was causing all the controversy in the New York Times and the obesity article, and the extent and helpfulness differ substantially by school and neighborhood. And what that means is that, for physicians, for people like me taking care of patients, that gives me some context to understand, people's food environments and, what might be influencing what they eat outside of my good advice and their best intent, and create opportunities for advocacy. I should note that the study we did looking at food advertising in the subway system came out at just like the perfect time. So I looked at all food and beverages and was able to subtract out the alcohol ads and look at that separately. And that is data that's actually helping to move policy right now. So there's a movement to ban alcohol ads in the New York City subway system. And that study was like huge in sort of bolstering advocacy group campaigns and making a case to the MTA and city council. And they're going to vote on it next week. So I've got a letter to the editor coming out in a couple of papers. But it's just, probably the most gratifying thing I've done, because as opposed to, where it goes, just sits on a shelf and, maybe my mother reads it, she doesn't. Someone actually read it and used it, and it translated to something immediately. So, creating opportunities for advocacy and for change and for changing policy. And then, businesses carrying foods or drinks might be persuaded. So, it's out there. And, it's kind of like I shouldn't go into gun argument. I don't even know why that came to mind, but, people maybe argue, it's out there, you can't restrain it, but maybe we can change it, maybe we can make it better, right? So we're not going to stop the salon and the barber shop and the dollar store from selling food, but maybe we can incentivize them to sell better food, and maybe that will be good for them. Maybe it'll be good for everyone. All right, so aim 3 is a very complicated statistical process. This is just an example regression equation that I put together just to show you the complexity of the hierarchical structure and the mixed and standard effects and whatever. And I'm not looking forward to that. But that's down the road once I get the data set put together. But basically, we're going to be modeling how not only the presence, like if it's there or if it's not, but also the proximity, within an eighth of a mile, half a mile, quarter mile. The density, is it just one fast food outlet or is it 20 around the school? And then the relative distribution. So if there's 20 fast food outlets, are they alone, or are they in the context of 20 street vendors selling produce, or 3 street vendors selling produce? Does that matter? And looking at that for our adolescent patients in a model that includes all those patient, school, and neighborhood characteristics. So it's going to take some computing power on patients. That's too common. So somebody had mentioned, I think it was Allison, about the bidirectional association. This is all cross-sectional. Somebody did that.
Karen, no.
Karen did? I'm sorry, misattribution bias.
We look the same.
It's hard to tell.
I have a doppelganger in the department. But anyway, so cross-sectional data can't really inform that, but this can lead to longitudinal data, or a longitudinal study quite naturally, because I have students in the electronic medical record. So you can follow them through time. They're the same student and they just get older and they have changes and things happen to them. We can look at that, and then we have to do, kind of a serial assessment of the food environment. Now that's the tricky part because that's the intense part. And that's actually a paper that I'm working on now, like how much things change and do you have to look at change? And I think, yes, clearly you do. It's kind of like these diet studies that people do where they do like a food recall of something that somebody ate yesterday and then look at outcomes 10, 15, and 20 years out. It's kind of silly, right? I mean, like diets change, people change, food environments change. So I think it's important to look at that. Anyway, so that hopefully will be fodder for future R1s and help inform policy and make things better. So I'm just going to end there. Thank all these good people and funders and collaborators and contributors, and everyone in the box is a student who pounded the pavement and walked the street and paid their dues in shoe leather and sweat. So they deserve your respect and adulation. I deserve credit.